Welcome back, everybody. There are some new guidelines that doctors and health experts are following to help people manage their cholesterol with one goal: to prevent heart disease before it begins. These new guidelines are meant to help with more precise risk prediction and lower cholesterol targets. Here to dive more into these new guidelines is Dr. Tariq Thannoun. He's a cardiologist at St. David's North Austin Medical Center. Doctor, welcome to our show, and thanks for being with us today.
Thank you for having me.
So we want to jump into what these guidelines are saying. What has notably changed about this compared to previous years and what they've put out there?
Sure, so the general principle that we have here is that longer time with lower cholesterol is better to protect someone from developing a heart attack or stroke. So the guidelines have reflected that by adjusting some of the targets that we have for people's cholesterol, adjusting the ages at which we screen for them, and introducing a calculator called the Prevent Calculator to help us calculate people's risk of developing heart attack or stroke in the future.
Do you feel this is a better way and approach to address some of those risk factors?
Yeah, I do. I think that especially in a city like Austin, where there's a lot of young, healthy people who are motivated to do what they can to keep themselves healthy, I think additional data points to help patients understand this is your risk without a medication, this is your risk with it, and here are the things that we can do to help lower your risk.
So some of these new guidelines mention things like risk enhancers. Those were the words that they put out there. What does that mean for someone who may not be familiar with that? And are there any examples?
Sure, so I think risk enhancers are, just a simple way of looking at it is that if you have someone who, based on this calculator, has a certain risk, what would make us shift that risk up or down? So certain things like kidney disease, people who have HIV or who are taking medications for that, family history, that kind of thing.
Okay, that's good to know. So the guidelines also recommend cholesterol screening in people as young as children. Why might that be important too?
Sure, so there are certain conditions like familial hyperlipidemia where people have very high cholesterols and develop heart attacks and strokes at a very young age. And oftentimes there's no real symptoms or signs of that unless we just take labs. So the idea, I think, is that we catch people at a younger age and put them on medications before it's too late to protect them from those consequences.
Yeah, to create better outcomes then.
Correct.
Well, if someone out there is watching this and wondering right now about what they should do to maybe get screening or take preventative measures, what would you suggest are the next steps to do that?
Sure, so I think if you have a primary care doctor, reaching out to them and getting your cholesterol checked, maybe getting a calcium score, and if there's any questions, establishing care with a cardiologist, I will never say that's a bad idea.
I would imagine not.
Yeah.
Is there anything else that stands out to you from that report? I wondered if you might have something else that we might have missed during our interview that you'd want to mention.
I think the use of a calcium score to help risk stratify people, I think, is important. Checking apoprotein B or lipoprotein A, these are some of these risk enhancers that there's a recommendation now to check for them, and it helps shift people either up or down in terms of their risk and should we put them on cholesterol medication.
Yeah, better to know all that information before something truly terrible happens. So,
Absolutely.
Dr. Thannoun, thank you so much again for joining us and for talking more about this. We appreciate it.
Thank you for having me.